Every year on this day, the call to end overdoses and drug poisonings is heard around the world. Tonight, people are gathering in communities across Canada to remember the tens of thousands of lives lost to this crisis. This is happening as discussions around access to supply and treatment are very much ongoing. Jason Gaidola joins us live tonight with more. Hey, Jason.
Hey, Kelly, there are definitely plenty of calls for more solutions that we're picking up steam online today, and also calls for people to better educate themselves if they ever come across someone showing signs of an overdose.
Okay, so we're just making.
Across the world, advocates are remembering those who lost their lives from an overdose and are showing solidarity with the color purple. Today on International Overdose Awareness Day, many are calling on others for more action.
On the streets of Wales, it's about getting out there, educating people, training people to reverse overdoses. It's about providing the harm reduction around the counterfeit drugs that we're seeing, the new emerged substances that are ravaging our streets out there.
Canada's Minister of Mental Health and Addictions released a statement and says in part, there is no one-size-fits-all solution to preventing or reducing overdose deaths. The country is in need of evidence-based options, including harm reduction services, peer support, pain management services, treatment, and recovery for those who are ready for it.
We have to do everything we can to protect our families, our friends, and our communities. We are working hard, and we've been listening to our partners, stakeholders, and the people directly impacted to address this crisis together.
We know that substance use is complex. We have to consider all the factors and the many different supports we need to meet people where they are in their journey.
Concerns also include the toxicity of unregulated drugs on the streets, mainly substances like fentanyl. In places like Ontario, health officials have said opioid-related deaths among young adults tripled between 2014 and 2021. Today, Montreal's health unit released a report saying it had the most interventions ever last year. Meanwhile, over in BC earlier this year, measures were taken, like the decriminalization of certain hard drugs under 2.5 grams.
It's our collective hope that this exemption will help reduce the stigma related to substance use, increase the access to health and social services, and decrease the harms related to criminalization, and ultimately save lives.
However, resources like naloxone to combat overdoses are also becoming a common fixture. A critical supply that even saved a Wisconsin police officer who had an accidental exposure. This week, south of the border, a drug manufacturer announced that Narcan supply will become an over-the-counter purchase at retail stores and online this fall.
We'll begin to have naloxone in our stores September 5th, and at the same time, we're going to make the naloxone available online. We really don't want there to be any stigma involved. So we've made this available at the front end of the store, over the desk, but also in the back end of the store, over by the pharmacy.
The federal government also restated its budgetary commitment of nearly $200 billion towards health care, which also includes mental health and addictions care.